So another SNP story, this time about ApoE. So remember, when we talk about SNPs, that stands for single nucleotide polymorphisms. They're not technically defined as mutations per se, but they're differences in alleles among our population, and sometimes we are finding now that those SNPs have some deleterious effects. So ApoE, what is ApoE? So as with all of these SNPs, it's usually within a gene that creates a protein that does some metabolic function. So ApoE is an apolipoprotein. So an apolipoprotein, and it happens to be apolipoprotein E. So they all have sort of different letters to describe the different ones. So lots of these apolipoproteins are responsible for binding, transporting, and the metabolic breakdown of lipids. So this is responsible for fat or lipid binding, transport, and breakdown. And importantly, we can think about this as having relevance in both the liver and the brain. So let's take the brain a little bit first, and I hope you remember that your brain is pretty much largely fat. So if you are ApoE deficient, and we'll talk about what that means in just a minute with different isoforms of ApoE. Okay? But if you are ApoE deficient, that means you're going to have an increased level of what we call A beta plaques. So these are insoluble sort of protein aggregates, and normally they can be cleared from your brain having, efficient apolipoprotein function that can sort of help with, coupled with your glymphatic system, to sort of clear out these plaques. But another consequence that we're going to see kind of played through a couple of other stories here is thinking about how ApoE deficiency sort of has a negative effect on glucose metabolism. Okay, and so we'll see more about that when we talk about sort of the connection with glucose metabolism and Alzheimer's disease. All right, so thinking about sort of impacts in the liver if you are ApoE deficient. Now in the liver, that's where we're going to see an effect on the increased amounts of triglycerides that are present, and ultimately too an increased level in circulating blood cholesterol, specifically cholesterol as LDL. So increasing blood cholesterol, specifically LDL. Okay, so all things that are problematic from having deficient or not as well functioning ApoE. You're going to have the increased prevalence of plaques in your brain. You're going to have increased levels of circulating triglycerides and potentially LDL cholesterol, and we're going to talk more about cholesterol a little bit later. So again, those can be all problematic if they're potentially coupled with inflammation. So we'll get to that in just a little while here. So highlighting here that one of the things that's unique about ApoE is the fact that it's present in different isoforms, and this is where the distinction is going to come with whether you have an ApoE isoform that's protective, neutral, or problematic. And so 3 isoforms that we know of are ApoE2, ApoE3, and ApoE4. Now the ApoE3 isoform is sort of the neutral isoform, and about 79% of the alleles are this neutral isoform. Okay? ApoE4 represents about 14%, and then ApoE2 is about 7%. Now, we're going to be specifically talking about sort of the complications that result from ApoE deficiency as it relates to both traumatic brain injury and things like Alzheimer's disease. But it's interesting to note that there is one of these alleles that actually seems to have a protective effect in this situation. There's actually a decreased risk for Alzheimer's with the ApoE2 allele. So you might ask, so what is that allele doing, and why do we even have it? There's some theory out there that this allele was actually something that maybe provided some type of a protective effect against infectious disease or something like that. But it happens to provide an increase or a decreased risk for Alzheimer's, but it's not very prevalent in the population. Again, most of the alleles are going to be of the ApoE3 isoform, which is sort of neutral. But the problematic piece is when we see that about 14% of the alleles are this ApoE form, which results in an increased risk for both Alzheimer's and traumatic brain injury, or TBI. So TBI is traumatic brain injury. So one of the things that we talk about with these ApoE alleles, since you get an allele from each of your parents, so an allele from mom and an allele from dad, when people talk about their ApoE status, they usually use two numbers to indicate, well, what are the two alleles that I have? For example, if you are 3-3, that means you have neutral alleles from both of your parents. If you're 3-4, that means you have one allele that provides is neutral, and then another allele that potentially provides an increased risk for both Alzheimer's and traumatic brain injury. And here's how the numbers sort of bear out. If you are of the 3-4 sort of status, you have a 3 times increased risk for Alzheimer's disease and traumatic brain injury. And then 4-4 is about a 12-fold risk. Well, that can be pretty scary to sort of think about, that you've got sort of this significant increased risk for something like Alzheimer's disease. Just to step back for a second and highlight, why is that? Alzheimer's disease is a result of the accumulation of these plaques that are in the brain. And if your kind of mechanism for kind of transporting, breaking down, and clearing out sort of these detritus, if you will, in your brain is negatively impacted because you don't have an ApoE that's functioning very well in that regard, then that can be problematic. Again, traumatic brain injury. When you have an injury to the brain, sort of that acute trauma is something that can actually initiate the formation of plaques, sort of as a way to shut down the portion of that brain just for a little bit to allow it to heal. But the thought is, well, no, we need to clear that out eventually and get back to kind of, business as usual. For people who are ApoE4, that clearing out process does not happen as well. So this might seem like it's really scary, especially if you find out that you are ApoE44. But keep in mind, we talk a lot about the fact that genetics might load the gun, but it's really environment that pulls the trigger. This idea that epigenetics and sort of our environment can play a huge role in whether or not genes ultimately are translated into disease. So things that you can do to affect sort of plaque formation are to make sure that you get sufficient sleep. Let that glymphatic system do what it needs to do. Avoiding stress and other forms of inflammation, which can compound this. But sleep is a huge player in sort of trying to mitigate all of these negative effects of ApoE.